This healthcare legislation is, in my mind, and in the minds of many, many people, the most pro-life, and I like to call it whole-life piece of legislation that Congress has ever passed. First of all, we're going to provide health care for women and babies. For women that are pregnant, women that are considering getting pregnant, and babies in utero and once they are born. Also within this legislation, there is $250 million grant program that can be utilized to help women, particularly teenage women, college-age women, and abused women, when they find themselves pregnant and in a difficult situation. It will help them with economic issues, so possibly with education, childcare, job skill training, and so the skills that they need to be able to take care of their child once their child is born. And so this is going to be a great program that I think will help give the support. It really comes out of what we call the Pregnant Support Act. That was a piece of legislation that actually Senator Casey had written and rolled into the Senate healthcare reform bill. And it's a great grant program that will go forward. But there was a concern that possibly some funds could be used to pay for abortion within the legislation. And I was concerned about this, as are many other pro-life individuals, as we were working on the final pieces of this legislation. President Obama signed an executive order shortly after the bill was voted out of the House and out of the Senate. And that executive order confirms what he guaranteed to the American people when he spoke to them, is that no federal funds will go for abortion. And the executive order, some people have claimed, is not codified and it's not statutory. And I agree with that, but I also want to say that executive orders are very powerful pieces of legislation, that the executive orders in the past have been such things as the Emancipation Proclamation or the desegregation of our troops. Very, very important policies have been enacted through executive orders. And so between the health care for women and babies, the $250 million grant program that will help women as they find themselves pregnant and in very difficult situations, and the executive order, this piece of legislation will do more to reduce abortions than I think anything that's happened in at least the last 30 years or more.